Cerebrovascular Accident CVA by Brianna Ann Madison. What is a CVA or cerebrovascular accident? Also known as a stroke is when there is a reduced blood flow to an area of the brain due to a partial or complete arterial blockage. It includes stroke, ischemic stroke, and hemorrhagic stroke. A common cause of ischemic stroke includes atherosclerosis. This leads a clot to form due to the damage of blood vessel walls. Ischemic stroke accounts for 80 to 85% of strokes. Hemorrhagic strokes happen when a blood vessel in the brain bursts, causing blood to leak into the surrounding area. That has a 30-day mortality expectancy in 40 to 80% of incidents. Disease progression. The disease progression greatly depends on how quickly the stroke is diagnosed and treated. Nurses play a key role in providing coordinated stroke care. Clinical manifestations. When assessing clinical manifestations of stroke, you can think of the acronym FAST, which includes facial drooping, arm weakness, speech difficulties, and time. It is common to see the facial drooping, arm weakness, and numbness in one side of the body. Other onset symptoms include confusion, severe headache, often reported as the worst headache in their life, trouble seeing in one or both eyes, dizziness, and loss of balance or coordination. Modifiable risk factors include hypertension, which is one of the leading risk factors for stroke. Tight control and management of hypertension can reduce the risk of stroke up to 50%. That's crazy, ain't it? Other modifiable risk factors include diabetes, smoking, obesity, and heart diseases such as AFib and myocardial infarction. Non-modifiable risk factors are things we cannot change. Hence, it is what it is. African Americans are at high risk for stroke because they have increased rates of hypertension, diabetes, and sickle cell anemia. Hispanics, Native Americans, and Asian Americans also have a higher incidence of stroke than whites. The risk of stroke also doubles every 10 years after age 55. Strokes are more common in men, but more women die from a stroke. Modifiable risk factors are those that can be altered through lifestyle changes and medical treatment, thus reducing stroke risk. These include stop smoking, limit alcohol to 1 alcoholic drink per day for women and 2 alcoholic drinks per day for men. Consume a diet low in sodium, fats, cholesterol, and high in fruits and veggies and lean proteins. Get physical exercise. Even light to moderate regular activity can produce benefits as well. Tight control of blood pressure, blood sugar, and cholesterol. Diagnostics studies are done to distinguish between ischemic and hemorrhagic stroke, which will help determine the size and location of the stroke and treatment options, and to identify the cause of the stroke. The MRI is more effective in identifying ischemic stroke. A CT scan is a rapid diagnostic tool to rule out a hemorrhage. And the CTA gives visualization of cerebral blood vessels for blockages. And the blood tests include CBC, lipid profile, renal and hepatic studies, prothrombin time, and activated partial thromboblastin time. These are done to help identify conditions contributing to stroke and to guide treatment. Medications. TPA administration should not be delayed for drug therapy for ischemic strokes. It breaks down the clot and reestablishes blood flow to prevent cell death. It should not be given to patients with hemorrhagic strokes. For safe administration of TPA, it is important to check that the CT was negative for hemorrhage. The patient has not had surgery, trauma, or stroke in the last 3 months, no signs of bleeding, and blood pressure, glucose, and clotting times are within range. The patient should not be pregnant or breastfeeding. 24 hours after TPA is given, the patient may be treated with aspirin to prevent further clot formation. Nursing management of stroke includes assess signs and symptoms of stroke and determine when signs first started. Screen the patient for contraindications for TPA therapy. Infuse TPA for patient with ischemic stroke. Assess respiratory, cardiac, and neurological status. Position the patient in semi to high Fowlers to prevent aspiration. Position food and personal items on the unaffected side, and a swallow study must be completed before the patient can eat or drink. Patient teaching. Okay, so prevention is priority with health promotion for a healthy lifestyle and management of modifiable risk factors. These include the patient should maintain a normal body weight, reduce sodium intake, follow a diet low in saturated fats and high in fruits and veggies, limit alcohol use to moderate levels, which means men can have two drinks per day, and women can have one alcoholic drink per day. And maintain a systolic blood pressure less than 140. Exercise 40 minutes 3 to 4 days per week. Avoid cigarette smoking and tobacco products, and maintain a normal blood glucose level and control diabetes. Patients should follow the prescribed treatment plan for diagnosed cardiac problems. And it's important to teach patients and families about early symptoms associated with stroke. And this ends our presentation. Thank you for watching.